Alright, so today we're going to be talking and kind of going through one of my early cases I did early this year at the start. And it's quite interesting because we learn a few things about a case like this and when we look through it. So let's get straight to it. Sally comes in, we do a full exam, we take some x-rays, take a 3D scan as well, and we look at all her teeth. We make sure that she's all good from the disease standpoint, and Sally over here had really good teeth. She cleaned them really well and she was quite young. I think to memory she was in her early 20s, maybe 21, 22 years old. And one of the concerns that she told me was that she wasn't super happy about the way her front teeth looked. You can see that her front two teeth look very worn down, just around here. And another thing that she was unhappy about was the small lateral incisor, which is this tooth here. Okay? Now when we're looking at this case, we talked about options. We considered her age, we considered the finances she wanted to spend, and I also wanted to get an understanding of where she wanted, like what result did she want? Did she want perfect teeth? Did she want a brand new smile? Or did she just want a little bit of enhancement to fix the little things that she's not happy with? What does she actually want? And this is really important because as a dentist, you can come to my practice and we can start talking about perfect teeth and doing a lot of treatment. But at the end of the day, my patients, or you won't be happy until I directly figure out what you don't like about your smile. So then we can address those things and those things only. Okay? So what we did was we took some photographs, we put it up on the TV screen, and we just had a conversation. And from that conversation, I gauged that she was quite happy with the color of her teeth. I think the color of her teeth are quite good. It fits her face quite well. The only thing that she wasn't too happy about was the length and the small width and the space between these two teeth. So we talked about options. Now, Sally's quite young, so I don't want to do any type of treatment that would be extensive. So nothing too aggressive. I don't want to cut too much of the tooth. She's only 20 years old. She's only had her permanent teeth for about 10-ish years. Okay, so at this age, if I start prepping the tooth, give her veneers, and she goes at the age of 30, 32, and she doesn't like them, it's more of an aggressive sort of treatment. We want to avoid that. So I think for her, the perfect option was composite bonding. Now, composite bonding is really cool. I recommend it to all patients who are quite young because it doesn't involve much prepping of the tooth. And if the patients don't like it and we want to do some adjustments, it's always possible. So in this case, we decided, okay, we want to do composite bonding. We just want to enhance the shape of certain teeth, and we don't want to do anything too drastic, and we don't want to change all her teeth. We only want to focus on the front 6 in her case. So we go back to the drawing board. I said, okay, Sally, I'll see you in a week, 2 weeks time. Let me just look, let me gather some information, let me plan some stuff out, and then we'll come back, talk. Now, I actually gave her a bit of homework. I told her, go back home, go on Pinterest, go on Instagram, find the type of shapes of teeth you like. Show me what you like, show me what you don't like, so I can try to gauge and customize these teeth to the way you like them. So after that, and I had a look, we look at a photo, we look at the teeth when she's smiling, we look at the teeth when she's resting. She has a little bit of display there, I would want a little bit more display at this age when she's resting in that rest position. And then we decide in an ideal circumstance, where would we want her teeth to be, ideally? So I do a bit of a sketch. I look, okay. Ideally, the front two teeth need to be about 1 mil to 2 mils longer, maybe 1.5 mils longer. Her lateral incisor, which is this tooth here, needs to be a bit wider to match the other incisor. And the canines need to be a little bit more pointy, as the older canines have been worn down. We also noticed that the premolars, which are these teeth here, are slightly pushed in, okay? And I let her know that. I said to her, look, I can fix your front 6 teeth, but your back teeth are also visible when you smile, okay? And they're not positioned in the most aesthetic spot. After talking about this, Sally was like, nah, I'm not too worried about my back teeth. I just want to fix my front 6. And when I grow up, get older, have more finances available, we might look at getting that treated. I said, no worries. We'll see what we can do, because I wanted to try to blend her front 6 teeth to her back 8. And the outcome that we got after, I think it was, we did 4 hours on a Friday, and then we did an extra 3 hours of polishing on the Sunday, was pretty good. And this was her final outcome. Now, we closed up that gap between this gap here and this gap there. We increased the length of the teeth, and we gave her a very natural looking smile. Now, this sort of composite bonding is all hands-on. It's not made by a lab like veneers and crowns. If you have more questions regarding what a crown or a veneer, what are the difference between composite bonding and veneers are, I'm making another video shortly, so just look at that. But in this case, we did composite bonding, where we basically layer a Play-Doh, tooth-colored Play-Doh type of material on the tooth to give it a very natural looking smile. And we layer different types of colors, because your tooth is not just one color. It has, you see different types of colors. You see transparency, you see reflection, you see the light darker hue of the tooth as well. And that's what we try to replicate for her. So if we look closely in her smile, you can see how the light reflects. It gives a very natural looking appearance. You can also see that as we go down the tooth, as we go down here, okay, you can start to see a few darker shades getting incorporated. That signifies the transparency when you would look at a natural tooth. In this case, I didn't want to finish just at this stage. I actually wanted to keep polishing and shaping the tooth, because I found that there were certain teeth that were not perfectly exactly the same as the other side. But in this case, she was really happy. She wanted the teeth to look a bit more natural and unique. She wanted teeth to be different shapes and didn't want them exactly to be in the same width, because it gave her a very unique smile and unique look. But overall, this was a really good case, and I recommend composite bonding to any patient that is quite young and just wants to get a little bit of an enhanced smile and not want to damage too much of their tooth. In this case, we didn't prep her teeth at all. If she doesn't like them or if they break, they're very easy to fix. There's not much risk involved. Very inexpensive option. And they can last you a long time if you take care of them. And even if they chip, it's only a 30-45 minute appointment to get them fixed up and get you back going. But yeah, this was a really fun case, and the outcome was really good.